Good morning, students. Today I will teach you cholera. So this is the organism of cholera. Now, cholera is an acute infectious disease caused by bacterium Vibrio cholera, which usually result painless watery diarrhea in human. Most people who get the disease ingest the organism through food or water source contaminated with Vibrio cholera. Now, what is the causes of cholera? How does cholera spread? Cholera is spread by bacterium called Vibrio cholera. A person gets cholera by drinking water, eating food, and infected with bacterium. Now, Vibrio cholera, the bacterium that causes cholera, is usually found in food and contaminated water by feces from person with the infection. Common sources include municipal water supply, ice made from municipal water, food and drink sold by street vendors, vegetables grown with water contaminating human waste, then raw or uncooked fish, seafood, caught waters and polluted with sewage. When a person consumes the contaminated food or water, the bacteria release toxins in the intestine that produce severe diarrhea. It is not likely you will catch the cholera just from casual contact with an infected person. Now, we'll see the now you know about the causes. Why causes? Contaminated food, contaminated water, or any uncooked food. So this is the main causes, and organism is Vibrio cholera. Now we'll see the sign and symptoms of cholera. So first is the watery diarrhea. Patient will get watery diarrhea, and it is a large volume. That water diarrhea is like rice water. So rice water stool, then fishy odor to stool, vomiting, rapid heart rate, loss of skin elasticity, washerwoman hands, then dry mucous membrane, low blood pressure, thirst, then muscle cramp, leg cramp, restlessness, irritability, and patient will get sleepiness and tiredness. Now, what is the other symptoms occur? First is the abdominal pain, cramps, patient will get severe pain, rectal pain, fever, severe vomiting, dehydration, low or no urine output, weight loss, and sometime patient will get seizure and shock, and if it is not controlled, then death. What is the incubation period for this cholera? The incubation period is time period from exposure to the bacteria to the development of symptoms. May vary few hours, about 6 to 12 hours. So this is the incubation period from the in the body bacteria will come and develop the sign and symptoms. So 6 to 12 hours incubation period. Now, how you will diagnose the cholera? Okay, first you should check the stool. It is rice water diarrhea stool. Okay, the next is the diarrheal fluid, often teeming motile common shaped bacteria. Then check the Vibrio cholera infection. So take the stool and check the microscopy like a culture and routine. Then also you should check the other blood routine investigation like CBC, sugar, urea, creatinine, electrolytes, calcium, that also you should check. Now what treatment we are giving for this cholera? First treatment is the ORS, that is oral rehydration therapy. So it is recommended first treatment for cholera is ORS. Okay, now next is that you check the patient's condition, then there is a need for admission, so first you should admit patient in the hospital, check the dehydration of the patient, and how you are giving ORS. So below 2 years you should give 50 ml to 100 ml up to 500 ml per day. Then 2 to 9 years you should give 100 ml to 200 ml to 1000 ml per day, and above 9 years as much wanted to 2000 ml per day. Okay, so like this you should give the oral rehydration therapy in adult patient. If 14 years above and the weight is above 30 kg, then you should give 2200 ml to 4000 ml ORS therapy per day. In severe dehydration therapy, you should start the IV drip like a ringer lactate and normal saline, and also you should start the oral rehydration therapy continue. As per weight and as per age, you should give ORS and ringer lactate therapy. And also in this condition you should check the pulse, because there is a pulse is weak and sometimes it is not detectable. Also repeat once of radial pulse is still very weak or not detectable, then reassess that patient every 1 to 2 hours. So if pulse is weak and it is not detectable, you reassess that patient every 1 hourly and 2 hourly for continue hydrating also. And if hydration is not improving, then you should give IV drip more rapidly 200 ml per kg. Okay, in the 24 hours, first 24 hours, and after 6 hours you should again start the reassessment and ORS solution. So already I told you about ORS therapy and IV therapy. Now I will tell you medical treatment, what medication we are giving for this patient. So first is the we are giving doxycycline, tetracycline, 500 mg BD, or as per weight or as per age, furoxine and erythromycin we are giving to the patient. Also azithromycin, sulfomethazole, ampicillin, ciprofloxacin and norfloxacin also we are giving. But sometime if patient is taking some antibiotics also, patient will get diarrhea, so that also you should check in this condition. Now how you will prevent the diarrhea? So first is the sanitation is very important. Effective sanitation practices, sterilization, proper disposable and treatment material that may come into contact with cholera. So there should be need sanitized by washing in hot water and using the chlorine bleach if possible. Then hand that touch cholera patient or their clothing, bedding should be thoroughly clean and disinfected. So you should disinfected patient bed and other articles and material also. Then sewage and fecal sludge management. Cholera is affected area, sewage, fecal sludge need to treat the manage carefully. And also you should if there is any management, then you should also manage the human excreta, sanitation, and you should maintain the patient's hygiene also. Don't use open defecation, so it is very important. Water purification, you should use the solar water, chlorination water. Then also disinfection, food also, disinfected food, hand washing after using the toilet, before eating the food, before preparing the food, there is 100% you should do the hand washing. So in this cholera it is very important, and main is the that if you are found out the cholera patient, you should inform, the hospital should inform district level, the district level will inform state level, the state level will inform to the national level, and that national level will inform to the WHO, World Health Organization. So if any village patient is available with cholera, so that should be informed to the WHO. So it is very important. Thank you.